You see, it's the brain-based therapies that we use in our office that corrects the problem with the decreased firing of the cerebellum. So it's imperative, folks, it's imperative that we find out what's really causing your problem, what's really causing your back pain, your chronic back pain. Maybe some of you have been to other chiropractors and are still suffering with this chronic lower back pain. You know what, folks? This does not have to be. It does not have to be this way. I want to introduce to you the spinal rejuvenation therapy that we do in our office and how it will eliminate your back pain, how it will increase your range of motion and increase your flexibility. For a lot of patients, it improves their posture. They're standing and sitting taller as a result of this therapy, and it prevents further decay and degeneration in your spine. My focus is on correcting your problem, folks, on correcting it, not just putting a Band-Aid on it with temporary results. You see, this program is a state-of-the-art program to rejuvenate, to revitalize, and to decompress the spine. We decompress the spine to relieve your pain. Most spinal-related problems, folks, to be honest with you, they come about due to poor posture, trauma like we talked about, car accidents, injuries, or stress. And we've all had these things in our lives. So when these problems are not corrected over time, your spine will start to decay and degenerate. This model here is a simple model I use it to explain and show patients what happens when the spine starts to decay and degenerate. This is what the spine should look like here. These are lumbar vertebrae here. These are the actual vertebrae. In between are the discs. And we're going to be talking about this later, are the discs. And these little yellow things that come out are the nerves that come out. This is normal. Now, when there's the old injuries we talked about, the car accidents, the falls, whiplash injuries, if those problems are not corrected, folks, what happens is the spine will start to decay and degenerate. There's going to be scar tissue that forms. The spine will decay and go into what's called a phase 1, where the disc starts to decrease. And what happens when that occurs is the nerves that come out, these little yellow things here, it starts putting pressure on these nerves here. The disc becomes smaller. When it's normal, the nerve has plenty of room to come out from this area here. And then it goes to a phase 1. Phase 1, left uncorrected, folks, will advance into a phase 2. This is what phase 2 looks like. The spine will start to decay and degenerate and actually start to deform. The bones will start to get deformed, so there's bone spurs, calcium deposits in this area here compared to normal here. The disc space is becoming really dehydrated and can even herniate. There can be disc herniations at this stage here. After phase 2, left uncorrected, maybe some of you have had areas of the spine where there's advanced severe decay, severe degeneration in your spine. This is what a phase 3 looks like here, folks. This is just like tooth decay. If you don't correct the problem, this will advance from normal to phase 1, phase 2, eventually phase 3. Okay? We're going to explain to you in a few minutes how we can stop this decay and degeneration process and help to heal these discs and help to heal these nerves that become pinched and irritated there. Okay? But the main thing is, you see, in order to correct the problem, to correct the back pain, the neck pain, the disc-related injuries and the disc-related problems, there are several things that that has to be considered. Number one is we have to eliminate the pain and inflammation. That's the first and primary thing that I focus on in my office. Eliminate the pain and inflammation. You want to increase blood flow, increase movements to your spine, and especially where the discs are at. To the discs, you want to increase movement and blood supply, to the ligaments, to the muscles, the tendons, so they can heal. Okay? And number 3 is we want to reduce or decrease those muscle spasms we talked about that hold the vertebra out of position. They lock your spine into that position there. And number 4 is we want to restore proper cerebellum function. That's this part of the brain right here. Again, that controls your posture and all the spinal muscles there. So we want to make sure that that's functional like it's supposed to, just like we talked about earlier. And number 5, folks, we want to permanently correct the spine and your posture. We want to make sure that we correct any postural distortions you may have, whether it's a high shoulder, a high hip, forward head syndrome, shoulders that drop forward. This spinal rejuvenation therapy program that we do will correct that. Thank you.